I'm going to get you set up. Just
Sure.
This is not really going to be loud. It's not going to project for the purpose of the recording.
Okay. All right. Okay. Thank you very much. Well, thank you everybody for including me today. It's really nice to be here and to be part of your morning this morning. So, and thanks for the nice introduction. So I'm going to talk today about sort of a philosophy or a kind of psychotherapy called mindfulness and acceptance. And some of you may have already learned these strategies or these principles, especially if you've ever done yoga or meditation. You'll probably hear a lot of overlap. And some of the things that I'm going to talk about also overlap quite a bit with what Lori, the cancer exercise specialist, talked about. There'll be some there's quite a bit of overlap in terms of finding ways to cope with stress and stress that can come with brain tumors. Does this work me up and down as well?
I think it does.
Yep. Okay. All right, so I'll just tell you a little bit about what we're going to do today. I'm first going to review the role of clinical neuropsychology at the Stan Cassidy Center for Rehabilitation, so you get an idea of who I am and what I do. I will briefly review some of the effects of brain tumors on psychological functioning. And then I'm going to discuss the basics of mindfulness and acceptance as ways to cope with suffering. We'll have an overview of some of the tools and benefits, and I'm hoping to leave some time again for some discussion and questions. I probably only will talk about 40 or 45 minutes, so hopefully there'll be some time at the end if people want to ask any questions or discuss things. All right. So a little bit about what the Stan Cassidy Center is. Some of you may know it. The Stan Cassidy Center is New Brunswick's provincial neurological rehabilitation center, and it's located in Fredericton. We tend to take the most complex, intensive neurological patients right across the lifespan. We serve patients across the lifespan with a variety of neurological illnesses, injuries, diseases, disorders, and so on. But we don't see all brain tumor patients. We tend to see the ones that are more complex, more complicated, that require more of an intensive approach, or maybe a team-based approach. I personally work on the adult team, and I work with both inpatients and outpatients. We have a 20-bed inpatient unit. Patients come with a variety of, that's mostly for adults. Rarely do we have children as inpatients. So we have 20 beds. Patients stay for as little as a couple of weeks for a very specific reason, or sometimes for months and months, depending on their injury and so on. As I said, we're really team-based, so it's very interdisciplinary, which is one of the reasons I love working there. We have rehab medicine doctors, we have nurses, physiotherapists, occupational therapists, recreational therapists, social workers, speech-language pathologists, dietitians, and clinical neuropsychologists, and we are about to welcome a respiratory therapist to our team as well. She hasn't started working yet, but that's an addition that we're going to have integrated into our team as well, which will be great. We are fully bilingual services since we serve the whole province. And I should also add that we sometimes have patients from outside of New Brunswick. It's rare, but we have had patients that come from the other Atlantic provinces that can't get the services they need in their communities, so they come to us. And we assess and treat several patients with brain tumors. Like I said, we don't get them all. We tend to get the patients that have more complications and need that intensive team-based approach generally. So the role of clinical neuropsychology, just to give you an idea more of what I do, there are 3 of us on the adult team who work alongside all those other professionals. We do comprehensive assessments of cognitive functioning. So one of the main things we do, a battery of tests to measure things like memory, attention, problem solving, and so on. So sometimes people after brain tumor, whether it's the brain tumor itself or the surgery or radiation or the complications that come from the brain tumor, may have changes in their thinking skills. And this might be impacting how independent they are, or whether they can work, or whether they can go to university, and so on. And so we measure those skills and try to help figure out what's working well, what isn't working well, and maybe we can intervene in some way. We also assess mental health. That's more, the traditional stuff that most psychologists do. We assess mood, personality, coping style, and so on. And often we're assessing both, if need be. We also help out with various kinds of interventions, sometimes psychotherapy for a variety of psychological problems that come along with neurological disorders and diseases. Can be mood disorders, could be anxiety disorders, behavior changes, personality changes. It's quite varied, and we help out. Again, it's usually team-based. We're usually working alongside some of the other professionals to work together to help a person get feeling as good as they can and to be as independent as they can. We offer consultation to the patients themselves, to family, to other caregivers, to other community representatives, other professionals, about psychological function related to neurological changes. And then, as was mentioned in the introduction, I have a particular passion for helping train graduate students. So we usually have students around participating in training, not just, I train psychology students, but the Stan Cassidy Center, it's part of our mandate to train and educate others. So we usually have a variety of students around, which really adds to the environment. Okay, so I guess the big question that a lot of you in the audience, or your family members, or somebody you know grapple with is, how do you live with a brain tumor? And the answer is, I don't know. I wish I knew, but I don't. I mean, you know, because you're living with it. And so I don't have all the answers. I wish, like I said, I wish that I did have the answers. I can't say that I truly understand what it's like. I work with lots of patients who struggle with this, and I don't have the answers. But hopefully some of the things that you're learning today, or some of the things you're learning in other ways, can help you suffer less, or cope better, or feel more at peace with it. And that's really the point of the mindfulness and acceptance philosophy, is to learn to live with suffering and feel better because of that. I'm going to talk about some realities first before we get into the nitty-gritty of mindfulness and acceptance. Because part of the whole premise of mindfulness is being realistic and stating it as it is and not trying to hide or deny or avoid. Brain tumors do impact your life. They can be associated with anxiety. Sometimes that's social anxiety about being out in public. Sometimes it's panic, in the middle of the night. Sometimes it's just fear of having to go to the doctor, go through an MRI. There's lots of different ways anxiety can crop up. Some people feel that they develop a post-traumatic kind of anxiety after a diagnosis or treatment. Mood disorders are also very common, and that's usually depression. Clinical depression is the most common kind of mood disorder. Cognitive changes, I mentioned that we do assess that for anybody who's had a brain tumor, brain surgery, radiation, chemo, brain. You know that cognition can change, and that can be things like attention and concentration. It can be memory and how well you can learn new things and multitask, making decisions, solving problems, finding your words when you're trying to have a conversation. There's lots of cognitive changes. Sometimes they're subtle, sometimes they're not so subtle, but they happen often with brain tumors. But not always. Personality changes. Some people find that there's a big personality change after a brain tumor or after the treatment related to brain tumor. Not always, but sometimes. Pain can be a big complication, especially headaches. Physical and sensory changes are common. Things like dizziness, balance, strength, coordination. And the sensory changes. Sometimes people lose their hearing or their vision. There's lots of their ability to tolerate light and noise, and so on. So there's a lot of physical and sensory changes that can come with brain tumors, which is very stressful And then, of course, there's the multiple life stressors and losses that are the indirect effect, but things like not being able to work, changes in your roles with your family, maybe changes to your finances, having to run to the doctor a lot. It can really turn your life upside down or sidetrack it for sure. And the first speaker, Melissa, talked about that very well this morning, her personal journey about how stressful it is. Just to point out that some of these changes are directly biological. Some of these changes, whether it's changes to your personality or your mood regulation or your cognition and thinking skills, are directly biological. It's neurological. The tumor has affected brain cells, perhaps the radiation or the surgery has affected how the brain functions. So there can be changes at just a biological, neurological level. But then there's also the more psychological level, the indirect changes, the having to cope with all the stress and loss. So I'm thinking about both as we talk. Now, anxiety and other types of suffering, and I'm going to talk mostly about anxiety as a mental health concern. But you can map this onto other kinds of suffering you may have experienced or know somebody who's experiencing, like low mood, depression, and so on. But regardless, anxiety is usually most problematic. Probably many people can relate to this, with or without a brain tumor, at night. So sometimes it contributes to insomnia. And there's lots of different kinds of insomnia. Some people find it difficult to settle down at night. You get into bed, you think you're tired, you do your nighttime routine, you get into bed, and then the mind starts to go. And you can't relax. Maybe you have some pain or other kinds of physical symptoms that make things worse. Or maybe it's just that hamster wheel in your head, not being able to turn it off, and you can't relax. Sometimes you fall asleep quite well, and maybe use a sleeping pill or something to relax you even, and you fall asleep okay, but then you wake up in the middle of the night. Who knows what wakes you? Maybe it's your bladder, you go to the bathroom, or something else, but you wake up in the middle of the night regardless, your mind starts going, and you can't relax, and you're thinking about all your stresses and so on, and you fill your brain with all that, and the hamster wheel starts going again, and you're awake for a couple of hours. Maybe you get up, maybe have a snack, whatever, or you go check your email. And it takes a while to get back to sleep, and then you eventually you do, and you wake up tired. The third kind of insomnia is what we call early morning awakening. And again, it's also quite common. Particularly as people age, it can be more common, but it's related to stress as well, where you sleep okay till maybe 4:30 or 5, around there, and then you wake up early for some reason, and you can't get back to sleep. You start thinking about your day or your worries or your stress or your aches and pains or whatever it is that's bothering you, and you're awake. So often people just give up and they get out of bed at 5 in the morning, and you're frustrated and you're tired, and then a few hours later you're tired again, and it kind of disrupts your day. So the things we're going to talk about today hopefully could help you with some of the insomnia or that nighttime anxiety. Anxiety often creeps into during other downtime, during the day when you're less busy. And then people get really guilty of filling your brain with stuff just so you don't feel that anxiety. That really doesn't help. It kind of puts it off for now. Maybe you do something kind of mindless, or you do busy work, or you find things to fill up that downtime. You don't really feel a lot better, but it sort of turns it off. It puts it more into the background. But then you're not really enjoying what you're doing. You might be trying to enjoy a nice walk or some time with family, and then all that noise is in your head, that anxious noise, and so you're not really enjoying it. Anxiety, of course, is related to medical checkups and procedures. A common one, of course, is having to have that repeat MRI. Very anxiety-provoking, waiting to talk to the radiologist or the oncologist, whatever the case may be. It's very stressful. Anxiety is also very common related to anniversary dates. You may find you're more preoccupied or more emotional around anniversary dates, the anniversary date of your diagnosis, your treatment, when chemo ended, when you first and forgot the diagnosis, etc. Whatever the case may be, those anniversary dates can be really stressful and raise a lot of emotions. It could be other anniversary dates, like your birthday or your wedding anniversary. It's something that makes you think about your life and passage of time. And then anxiety is also often triggered by other symptoms, and they could be just, non-brain tumor symptoms. You could just have a bad day, you have a headache, or you're just extra tired one day. It means nothing, but you start to ruminate and worry, and then that old hamster wheel of anxiety starts running your head. Now, some other realities to keep in mind, that all humans experience suffering at some points in their lives. That's just the way it is in their lifetime. Everybody has sometimes when they suffer. It could be a physical illness, physical pain. It could be an emotional event. It's usually both. One can feed the other. But it's part of the human condition. Another reality is that to experience fear, sadness, grief, regret, etc., like those negative emotions, those basic negative emotions are normal. I often talk to patients who say, I shouldn't feel this way. I don't want to feel that way. I should be able to cope better than this. And they're doubting themselves, and they're angry at themselves, or judging themselves for having what would be really normal emotions. It's not a weakness, it's just normal. And it's so to accept that, it can help and get on the path to feeling more at peace with having these normal emotions. And just to point out, the close family and other caregivers suffer when their loved ones are suffering. And again, it can be the indirect or it could be the direct impact. You feel badly seeing your loved one suffer or go through difficult times because you care, but then also indirectly your lives are changed. Maybe your role has changed, maybe you have to do more to help. It could be impacting just your family life and so on. So it can have a double whammy as a caregiver. I'm just going to put up the sources. I'm not going to go into a lot of theoretical or statistical information today, the research and so on. I'm going to mention it. I come from that background of the way I've been trained to make sure I understand the research and use strategies that are based in evidence. And so the two books that I pulled from for this presentation today are called Full Catastrophe Living and Mindfulness and Acceptance. The first one I do recommend if you haven't read it. It's a nice read. It's even read bits and pieces. It's 25 years old, still very, very current in the way it's written. It can apply. It's very timeless. Catastrophe doesn't really mean disaster. I mean, we think of the word catastrophe meaning disaster. What he really means is the full experience of life. That about embracing suffering, not catastrophe. But that's the title. Anyway, I do recommend it as a nice read. The second one is really theoretical. It's much more the research behind things, and you probably wouldn't find it very interesting unless you're really into reading a lot of theory. So I found it useful to help me, prepare, but I'm not really recommending it to you. I'm just giving them credit. Another thing I just want to say before I jump into more of the if you've taken mindfulness or meditation courses before, some people approach it from a real spiritual, mystical kind of perspective, which is absolutely fine. I'm not going to talk about it really from that angle, because that's not really how I use it, or I've learned it. I do work in a medical center. I work with a lot of brain biology, and I was trained to think more like a scientist. So not that I am against the spiritual, mystical way of looking at this, but I'm not going to talk about it from that angle. But I just say that because if you prefer to think of it from the more spiritual, mystical way, I support that. It's just, you can listen through those ears if you want. But I'm not going to talk about it like that. Okay, so again, back to the evidence-based. A little bit of theory here. I'll walk through it fairly quickly. There are several evidence-based types of psychotherapy for anxiety and depression, meaning it's been researched, it's been proven. Psychologists and other mental health researchers have looked at what works and what doesn't work with different kinds of populations. So cognitive behavioral therapy, and many of you may have heard of this, it's the most widely studied kind of evidence, most widely studied kind of psychotherapy, so it has the most evidence behind it, most research behind it. It's been shown to be very effective for people with anxiety and depression and a lot of other psychological disorders. It was mostly developed in the 70s and 80s. Certainly that was what I was mostly trained with. And it's still very popular and widely used. So cognitive behavioral therapy focuses on helping a person change his or her negative, maladaptive thoughts and beliefs about yourself, about the world, about your situation, and change those thoughts to be more rational. What's realistic and what's going to be more helpful way to think and to feel. And the hopes is to improve your mood and to maybe change your behaviors so you cope better or you take care of your health better. Now, acceptance and commitment therapy, well, I'll talk a bit about that, and mindfulness-based cognitive therapy are two more recent spin-offs. They combine cognitive behavioral traditional methods and knowledge with some other new things and some old things. So they're really very closely related to cognitive behavioral therapy, and they're also well researched. So there's evidence behind using them. Anyway, that's really what I said in the last point. So they've been evaluated through stringent research, and they've been found to be very effective. Now, like I said, some new and some old. Mindfulness principles are really based on Buddhist teachings from thousands of years ago, the deep breathing, meditation. I'll talk more about that in a bit. So they're very old. There's nothing really all that new. It's just been repackaged. So in the 1990s, really until today, they've been researched and repackaged and popularized. I'm going to give credit mostly to Jon Kabat-Zinn, as I mentioned. That first book, Full Catastrophe Living, that I mentioned, he had written that book. Marshall Lanahan is also another psychologist who studied and published and reworked some of these, cognitive behavioral therapy and mindfulness together to develop some really useful therapies. So mindfulness is both new and old. So some ideas behind mindfulness and acceptance. And I'm going to use some terms just to kind of get you in the idea of what I mean. So these are quotes or borrowed from the two books that I mentioned a few slides ago. So it's the idea of living awake with your eyes wide open. So allowing experiences and feelings to happen without avoiding them. You can also think of it as the intentional process of observing, describing, and participating in reality. This will become clear as we go. It's about being non-judgmental and just being in the moment. It's about paying attention and increasing your awareness of thoughts and feelings. So back to the hamster wheel, or that mindless worry we go through. We're not really experiencing life in the moment when we're thinking and feeling that way. Mindfulness is mostly about accepting reality and refocusing your attention. Some other ideas related is to take what is offered. It's the active and non-judgmental embracing of experience in the current moment. So instead of saying, I don't want this to be the reality, I can't believe this is happening, I refuse to accept this. Well, really that doesn't work because it's not realistic. It's instead of doing the opposite and saying, this is the reality, and I'm going to have to live with this and find a way to be at peace with it and enjoy what I can enjoy. So it's a sense of willingness, a sense of letting go and being rather than doing. Willingness to take what is real, what's happening, and enjoy the moment when you can. And remembering that your thoughts are just thoughts. They're not really you, and they're not really reality. It's just thoughts going through your mind. So this is a new way to experience physical sensations, thoughts, and emotions. It could be your physical sensations related to aches and pains, your brain tumor, or other health problems. It could be the thoughts that go through your mind, the emotions you feel. It's instead of fighting against or trying to deny, it's accepting and embracing and living with them. So I'm going to go into a little bit more of the 7 main principles of mindfulness. Again, there's some lingo, but hopefully it'll become clear. So again, this is from the book John Kabat-Zinn's Full Catastrophe Living. And he is really the guru of all of this. So the 7 basic principles. And you'll hear some repetition here, but so non-judging. It's trying to observe and notice thoughts and beliefs rather than judge them as good or bad, or liked or disliked. If you're noticing that you're judging your judgments, then, try not to do that. You're just taking note, just noticing, and rather than attaching those labels of something's good or something's bad, or you like something you don't like. It's just noticing and taking a non-judgmental way of thinking. Another principle is having patience. Some things must just unfold in their own time. We don't have to fill up all our time with activity. We don't have to hurry our minds along. And that's really typical of our culture now. We're busy all the time. We're supposed to be busy and productive and hurrying and filling our minds with activity, and we're not really experiencing. People criticize teenagers these days of always on their phones. They're always looking at their phones. They're always entertaining their minds with whatever, electronic, and they're not maybe experiencing the life around them or noticing much about their day-to-day experience. The next principle, the beginner's mind, I think this is my favorite principle of mindfulness. And this is having a mind that is willing to see everything for the first time. So those day-to-day things you do on autopilot, whether it's driving to work or walking your dog or washing your dishes or whatever you can think of, we get really mundane. Maybe we're worrying while we're doing it. We're on autopilot. We're not really enjoying or experiencing or noticing anything. So it's being able to shift to a more open way of looking at that and making each moment unique. And I'll talk a bit more about that when we come to some of the specific tools. Trust is another basic principle. And that's really about trusting in yourself and trusting your feelings and honoring those feelings. Again, we tend to judge ourselves. Oh, I shouldn't feel that way. Or, what's wrong with me? I must be weak. I'm a failure. It's that harsh internal voice judging us rather than trusting those feelings that you're having or just honoring your own thoughts and experiences. All right, non-striving. This is a bit hard to explain, but it's about trying less and just being more. Again, we tend to be always saying, I should do this, I should be able to do this, I don't want to do that. You're always, feeling that you should be more goal-oriented and always looking to the future, but not enjoying the present. And criticizing yourself along the way for all the goals you're not meeting. So it's just trying to be in the moment and experience experience today rather than be always forcing yourself, just striving for something that may or may not happen. Acceptance. Acceptance is another tough thing for most of us, but it helps us get past that wasted energy and stress when we're trying to deny and avoid reality. So again, I shouldn't feel this way. I don't want this to happen. I don't want this to be real. I want to wake up tomorrow and this to all be gone. Well, that really doesn't help. You could spend a lot of energy wishing for those things to be different. So it's a willingness to see things as they are right now. And surprisingly, most people, when they start to do that, actually feel much more at peace. And they feel much clearer in the way they think and feel. And similarly, the last of the 7 basic principles of mindfulness is letting go. So letting go of that struggles of the mind. Let go of the past, let go of the future, let go of the judgments we make. Just observe, notice, and watch. Okay, some barriers or non-acceptance of mindfulness. And we are all guilty of this. You may think of some things that you do. Procrastination is a big one. Don't we all do that? Like, oh, I put off doing this and put off doing that, but it's still there, and it niggles at you, and it bothers you, and it wastes a lot of mental energy and makes you more anxious. I'm going to use a really trivial example from my personal life. I hate washing dishes. I just don't like washing dishes. So I can procrastinate, I can wander away, I can find something else to do, but the dishes are still there, and then they're annoying me, and so I try to be more mindful and just get those dishes done, and then, I can move on and enjoy the rest of my evening. So I'm guilty of being a dishwashing procrastinator. But there's lots of things. I mean, we all do it in different ways, but it really does bog you down with that background noise of anxiety. And it goes against that mindfulness and acceptance way of being. Denial, again, I've mentioned. Denial has its place. When somebody, for example, has a new and terrible diagnosis or injury, most people engage in denial for a little while because they need a bit of time. They need a bit of time to absorb and process and get support around them and regroup. So denial has its place, and I see it a lot at work, and you can only push people through it so quickly, but and I don't. But eventually, denial isn't really doing you any good. There has to be a point where you have to let go of denial and accept reality the way it is, and then you can take some action and move on. Obsessive worry, again, most of us do it at some point, like I said, often in the middle of the night. It's a barrier to truly accepting and having a more mindful way of being. Related to that would be dwelling on the past or fretting about the future. It's something that comes with having this big forebrain that we all developed as humans, where we can remember the past and think about it and hopefully learn from it, and we can also think about the future. We think we're really the only animals who can really do that. So it's a great advancement, but it also is no pain because it makes us dwell on the past and have all these regrets that, eventually you just have to let those go because they're bogging you down mentally. Or the fretting about the future. Planning is, a benefit of having that ability to think about the future is planning, but sometimes planning just becomes fretting. What I have to do tomorrow, or what I have to do next week, or what I have to plan, and trying to anticipate everything that's going to happen, and that takes a lot of mental energy, and you're not then living in the present, and you're not enjoying today or the moment. Avoidance of emotions, again, that's sort of linked to that denial. Some of us were raised to think having emotions is weak, having emotions is a negative thing. Well, again, we're all humans, and emotions are a normal part of, that's a big, huge part of how our brains work, is having emotions. Emotions are motivating, emotions are good for communication, and emotions are important for just our personalities and who we are. Avoiding them, suppressing them, pushing them away, denying them really just makes things worse. It tends to make depression worse, anxiety worse, and so on. And that's been proven over and over again. There's real scientific research to prove this. So experiencing your emotions is part of being mindful, not avoiding them. Substance abuse can be a big problem for having an accepting or a mindful stance. So you're trying to avoid or suppress or forget how you're feeling, and really gets in the way of a healthier, calm way of being. Impatience is another thing that can get in the way of learning to be more mindful. And we're always in a rush. We think we're supposed to learn this quickly, and we don't want to take the time. Mindfulness, or really changing how you think and feel, takes practice. Takes cultivation, and it takes, it does take time. So I'll explain that more when we get to the part about psychotherapy. Okay, some tools. And we'll get down to some of the actual nitty-gritty. And I want everybody to try this. So I'm going to talk about deep breathing. Lori, the exercise cancer specialist, talked about deep breathing. She didn't go into it in a whole lot of detail. Maybe you've already learned this. Lots of people teach deep breathing. Psychologists do. Exercise, personal trainers teach it. Yoga instructors teach it. Meditation instructors teach it. Lots of different professionals teach deep breathing. So what I want you to try, everybody, I'm just going to do like a 1 minute demonstration for those who. So everybody, I want you to put one hand on your belly, just kind of at your belly button or slightly above your belly button, and the other hand on your chest, just below your collarbone. So you can feel those collarbones just below there. And try to relax a little bit, just let your shoulders relax. You can close your eyes if you want. I'm not going to do anything really weird. This is just a basic instruction on how to properly deep breathe. Okay, so the first thing I want you to try to imagine is that your lungs and your belly are like balloons, and when you breathe in, you're going to breathe and you're inflating balloons. And so I want you to try to make your belly rise when you breathe in. And so breathe, imagine those lungs are balloons, you're filling up. You breathe in and your belly is going to rise a little bit. For a lot if you're really good at it, but it does take practice. Try that a couple times. So breathe in, that belly hopefully is going to rise. Now I want you to pay attention to your upper hand, the one on your chest. And hopefully that upper hand is staying flat and not moving, or moving very little. Because when we're more anxious, we tend to breathe with the upper part of our lungs and bronchial tubes, and we heave our shoulders, and everything's kind of tight. So that's a more anxious kind of breathing. A more calm and relaxed breathing is that belly breathing, and your chest and shoulders are relaxed and not moving. It doesn't matter whether you breathe in through your nose or out through your mouth. Some people choose to do that. It doesn't really matter. You don't have to worry about that. Sometimes it just makes it more confusing. You can just breathe in and out through your nose or mouth, whichever you prefer. But the idea is your lungs are filling and your chest is staying relaxed. Okay, you can stop. So, I do really recommend practicing that. It's great for if you can't sleep or if you're just having an afternoon rest. And it takes practice. And it's also proven to help make a proper exchange of the chemicals in your blood, the carbon dioxide and the oxygen. It helps balance them out. When we're anxious and breathing really shallow or maybe hyperventilating, if we're stressed or we're all tense, I tend to throw the balance of those biochemicals off. So there's some physiological reasons behind it too. So I do recommend trying that. If you get stuck and you're not sure, you could probably look it up on YouTube or Google it, and there would be descriptions and examples. Don't hold your breath. That's another thing that people do. Sometimes it's good to cue yourself. Am I holding my breath? Because if you're tense, you're stressed, you're often holding your breath or breathing too quickly and shallowly. Okay, so that's one thing you can try. Visualizations are used sometimes with breathing, sometimes with meditation and so on. Visualizations I like to use combined with the deep breathing. And what I mean is you're just in your own mind thinking about something. Now, people who learn to meditate might do this in a different way, but a sort of a simple visualization is to, for example, picture yourself in your favorite place. Just take your mind to somewhere where you're calm and happy and comfortable. It could be on the beach, it could be in the woods, it could be in your garden. It doesn't really matter. Just pick somewhere in your mind where you're really comfortable and you can feel happy. And then in your mind, think about what you see and what you hear. Maybe you hear the birds singing, or maybe you hear crickets, or maybe you hear the ocean or babbling brook. It doesn't really matter. So the sounds you hear, what you feel the warm sun, you smell the ocean breeze, etc. So you're using the multiple senses as you visualize, and hopefully cue yourself to the deep breathing at the same time. The other thing is to be really careful is to let those judgments go. So if you're doing this and you think, oh, this isn't working, what's wrong with me? And my mind keeps wandering and I'm not focusing. Well, try to let that go. That's normal. Everybody finds their mind wanders, and then they get thinking about their grocery list or their doctor's appointment. Try to just gently get yourself back and let those worries drift away. The negative thoughts, some people visualize the negative thoughts or those anxious, judging thoughts. They visualize them maybe floating away like bubbles, or drifting by in a stream, or drifting out with the tide, or going by like clouds. And again, you can choose what works for you, but letting go of those negative thoughts and those harsh judgments and having a little break from that is a really a good strategy to try. And I do use this myself. And I explain it to a lot of my patients as well. Okay. The next one is kind of a neat one. If in a smaller group, you can, and a lot of people who've taken a mindfulness or meditation course have done the Raisin Experiment. Again, this is described in John Kabat-Zinn's book, and I have done this in a mindfulness workshop once. And the idea is, so he hands out, or the instructor hands out a raisin to everybody, and most people think a raisin, like that's just the brown blobs that we eat, it's a common everyday thing. But instead you look at that raisin like you've never looked at it before. You look at it and you look at it and you look at it and you look at it. There's different colors actually. If you look really closely at a raisin, there's different shades, and then there's all the little wrinkles, and the light shines on it in different ways, and then you spend some time thinking, wow, this raisin's kind of amazing. But that's all you're thinking about is that raisin. Again, if your mind wanders, that's okay, but try to get back to the raisin. And then gradually you put it to your lips, and you feel how it is on your lips, and then you put it down your tongue, and then you move it around in your mouth, and you think about the textures and the tastes, and it's kind of, sort of sweet, sort of sour, and then eventually you chew it, and you swallow it, and so on. And you stretch this out for, a true meditation expert would stretch this out for 10 or 15 minutes, just experiencing the raisin. And I mentioned the beginner's mind before. It's like that experience of actually slowing things down and experiencing things for the first time, or something really mundane is unique and interesting. So you could try it with a raisin, but you could try it in other ways. And I'll go back to my own example of how I hate washing dishes. So just the other day I was thinking about this, so I thought, I hate washing dishes. I'm going to try it with a beginner's mind. And it actually was really kind of nice. So I noticed the feeling of the warm water on the hands, and how the bubbles smelled kind of nice. And I looked out the window and thought about the view instead of how much I hate washing dishes. And it made a much more pleasant experience. So again, you can try it with any mundane thing you're doing, driving to work or walking the dog or doing your household chores, or sometime when you're feeling either on autopilot or anxious. It's trying to see something new, see something old with very new eyes, that beginner's mind. Now, I've mentioned meditation several times. I've never really been taught properly how to meditate. I've never taken a meditation course. I only know the basics. I won't be able to do it justice, so I won't talk about it in a lot of detail, but it is certainly a very useful tool for attaining mindfulness. It's great for coping with chronic anxiety, chronic pain, or just for people who are open to it and find it interesting. It's really about non-doing and just really being in the moment. It's taking mindfulness to somewhat, I guess, sort of an extreme, or I don't know if that's quite the right way to describe it, but I do recommend trying it if there are lots of meditation groups, and I know there are some in Fredericton and St. John. I presume there are some in Moncton and most communities. Yoga is also very connected to mindfulness. Most people have taken yoga or heard about yoga, and again, they use a lot of these principles of breathing and being in the moment and relaxing. Being in nature is another way. A lot of people can feel more mindful, getting away from the noise and the hustle and the bustle and the electronics and the lights and the daily chores and so on. There's lots of research to show that being away from that and being around green living things and fresh air really is very, very good for the mind and body. Again, Depends on who you are, what you like to do. It could be a walk in the park or sitting in your garden, or it could be really getting away to nature, going on a hike or going to the beach or getting out in a boat. It doesn't really matter, but it's, again, getting away from the everyday stressful life can make you feel more mindful and at peace. Music, art, and creative processes, some people find very helpful. Listening to music or creating music, engaging in art of any kind, pottery. As long as it's taken to be more mindful, it's about being more at peace and being quieter in your mind. Not just about being busy and filling your time and avoiding the anxiety. It depends on how you use it. And exercise. I didn't list exercise, and I should have, but some people find that exercise can get you out of that busy, negative, anxious mind and into a more relaxed and calm, peaceful mind. So exercise can be great for that too. Psychotherapy, there's group psychotherapy, there's mindfulness-based cognitive therapy that takes you through, it's a very structured, ironically, kind of a structured program to get you, to train you how to be more mindful, and that exists in some places, but it doesn't have to be like that, but other kinds of psychotherapy can help you become more mindful and more accepting. And then radical self-acceptance. Some people talk about that. That is really hard for us. We're usually not raised to think this way or believe that this is okay, but really accepting who you are, accepting all of your flaws and your imperfections and your negative emotions, and just being with them rather than judging and trying to push them away and fight with them. So, we talked about quite a few mindfulness, the basics and the basic principles and some of the tools. We don't have a whole lot more time. We'll talk a little bit about psychotherapy. Now, I am a psychologist and I am biased a bit towards psychologists, but there are lots of good ways to get mental health counseling. I do recommend people make sure that whoever they go to work with is a licensed professional. That means they're regulated. Psychologists need licenses, social workers need licenses. Just because somebody has letters beside their name doesn't necessarily mean they have real credentials, or they've been judged to be professional and have the right skills. So I do recommend people check that out before you seek any professional help. It's worthwhile to ask for evidence-based therapy, meaning some kind of therapy that actually has some research behind it. Again, some mental health counselors, especially if they're not regulated or licensed, might do some kind of therapy that doesn't have any evidence behind it. You might be wasting your time and your money. I mentioned some of these before. Some of the most, like I said, the most researched and evidence-based kinds of psychotherapy are cognitive behavioral therapy, acceptance and commitment therapy, mindfulness-based cognitive therapy, and interpersonal therapy. I mentioned these four. There are others. These four have all been found to be really helpful for people with anxiety and depression, especially related to health problems or significant health problems. But not just that, but there is evidence behind those four. Many insurance plans will cover some psychotherapy. If not, most community mental health centers provide some counseling or psychotherapy. Some of the university training centers, another one at UNB, offers some cheap psychotherapy. So there are other ways. I guess the last point about psychotherapy is remember that it is hard work. It's not really just about going and having a nice chat with somebody. It's about trying to change the way you think and feel so that you actually can make your life better and has some long-lasting impact. Combined with medication, now it's easier to take a pill for depression and anxiety, and I'm not against that. But combined with psychotherapy, does have longer lasting impact. We actually make some changes in how you think and feel. So some benefits of mindfulness. and other evidence-based psychotherapies. Hopefully you're going to experience reduced anxiety and improved mood, and that will be the main goal. Hopefully you'll feel more at peace and more accepting, again, more realistic, but at peace about how your life is going and being able to live more in the moment. Psychotherapy also hopefully helps you with more resiliency and flexibility. So life throws you these challenges. One of the main mindfulness gurus, Marshall Linehan, talks about, you probably all heard that expression of, when life gives you lemons, it's making lemonade. So finding ways to face your challenges and work around them, being a bit more emotionally resilient. Better sleep, we'd all like better sleep probably, but these mindfulness techniques, even the simple ones that I explained about deep breathing and visualization, can help you have a better sleep. Likewise, improved energy levels and improved physical health. So things like mindfulness can bring down your blood pressure. And hopefully other health-related behaviors. You'll be feeling better, sleeping better. Lori talked about quitting smoking and eating better. Those are some of the positive spin-offs that can come with psychotherapy. Also maybe lower need for medication. If you take medication for mood and anxiety and so on, again, I'm not against that per se, but sometimes they have side effects. Sometimes people don't like taking them, so you might be able to reduce your medication. And then the final spin-off, and this is really helpful for people with brain tumors often, is that cognition can get better. Your thinking skills can actually, we think, again, this is being researched, it's a little, but we think that mindfulness and other related things can make your thinking skills sharper. If you're more focused, if you have less of that hamster wheel going in your mind and that autopilot, and your mind's filled with negative thoughts and anxiety, and you're not focused on what you're doing, it seems to be quite common sense that you're not going to be able to remember as much. It's going to be harder to multitask. Concentration is going to be off. It's harder to make decisions and solve problems. If you calm your mind down and slow down and be in the moment and be able to reduce some of that anxious mental noise, your cognition should improve. It may not get all better, but it should improve. All right, so thank you very much, speaking of attention, for all your attention. I don't mind emails if you have a specific question, and I don't mind sharing this presentation if you want.